So again, as Karina said, thank you to Praxis for supporting this project over multiple academic years, and it's been actually really beneficial for us to do this project over several years, and you'll see why as I go through the project. I'm Erica Borgstrom. I'm a senior lecturer within health and social care, and I was the previous qualifications lead for that curriculum area. And I'm presenting today on behalf of quite a large project team. We've tried to involve quite a few different stakeholders in this project, from our associate heads of school to ALs, staff tutors and students, and senior manager of qualifications, because the thing we were looking at about providing students feedback when they have failed the module but can resubmit their EMA involves actually quite a lot of different people in the university to get that process going. So we wanted to involve all of them in the scholarship throughout to help us understand what's going on and improve what we were doing. To start with, I'll give you a bit of background about what was happening in health and social care and what inspired this project. So within health and social care, like in a lot of parts of the university, if a student scores between 30 and 39 in their module and they have submitted their EMA, they're offered an opportunity to resubmit that EMA. So I should clarify, in health and social care, for the last few years, students only have EMAs. We don't have exams anymore. So we're just talking about EMAs in this context. During the 17J conflation, our flagship level 1 module K101 piloted sending out personalized feedback letters to all the students who were eligible to resubmit their EMA. And in these letters, they provided 3 bullet points specific to that student about how they could improve their individual EMA. And they did a year-on-year comparison after that pilot and determined it was fairly successful in terms of there was an uplift in people completing the EMA resubmission. And so with the support of that head of associate school at the time, that practice was rolled out across the health and social care curriculum area for the 18J conflation. And so that's 10 modules. And for that conflation period, we saw approximately 150 letters sent out to students across those 10 modules. I came in as qualification lead in, I want to say, the start of the academic year 2019. So after this, just as the resubmissions were coming in essentially, and I wanted to look at, actually, once we've rolled this out, what was the evidence of this still being useful? Because okay, the pilot said it was useful for K101, but now that we're doing this on a curriculum scale, what is it looking like? And again, we just did some quick year-on-year comparisons, which are problematic in themselves, as I'm sure a lot of you know, but just to get a sense of what was happening. And what we discovered was there was actually a lot of variability. Some modules saw there was improvement with what they had done. Some saw that it didn't improve student completion rates or pass rates. And actually, when we looked at sample letters about how all the different modules sent out these feedback letters, we noticed there was actually quite a bit of variability in terms of how people understood the guidance of a letter with 3 bullet points, and some letters were multiple pages long, for example. So clearly the feedback was much more extensive. And so we wanted to sort of understand what was going on and think about how we might refine this to improve the practices within HSC. And at the core of this is attention that also speaks to some of my other research about how do we standardize things that we also want to have to be personalized. Because we're working at scale, we want things to be standardized to a certain sense, but at the same time, we want these individual aspects to be quite personalized. So bringing on the whole team that we're working on this project, we did a literature review about feedback, how students think about feedback, types of feedback they like, also how staff perceive feedback and what they think they're doing when they're giving feedback. We then did a survey with students back in February and March 2021. To understand their preferred type of feedback and the mode of delivery for that feedback. And that was to then inform the trial that we ran for 20J conflation, where we, and I'll talk about this in more detail, looked at 2 different types of providing feedback to see if, one had increased completion rates and submission rates and pass rates. And then we've evaluated this process and impact. And so there's been lots of different types of data collection going on for this project, trying to get at what we're doing, how we might do it better, and how can we really help students when they're in this situation of having to resubmit their EMA. Now, for that first survey about student views around the feedback when they failed, we surveyed with the help of RSPP, if I get that acronym correct, the available students from 18J onwards who had either received a result of fail and entitled to resubmit, or had received a pass 4 within our curriculum area. And the idea that we included those students who had received a pass 4 is because they were quite close to potentially being one of the students who could have failed and be entitled to resubmit, or they might in the future be such students who would receive such letters. So we wanted to know what kind of feedback they also thought was useful. We had quite a low response rate, partly probably because of the topic of failures. So students who even did respond said, you know, it's quite an emotive topic. It's something they find quite difficult, quite personal to them. And also it was at a time when RSPP said actually lots of students weren't engaging with surveys, like COVID survey fatigue was quite high at that point. In that survey, we asked about 3 different feedback examples that were informed by our literature review, and that looked at a detailed grid that reflected the marking grid that we use across our modules, the concise 3 bullet points, which was at that point the practice that had been used in HSC, and audio feedback, and that was coming out of the literature review about what students like. Now, students in this survey said they really liked the detailed example. They wanted more information. That's essentially what came out. They wanted more information. But they said actually all types of feedback that we asked them about, they found to be informative. And the 2 types of written feedback were more popular in terms of giving exactly the right information. And they found the detailed example, so that marking grid, more motivating than the concise example or the audio example. So from the survey, we kind of get a sense of, okay, they want more information and aligned with the marking grid. But interestingly, there was a split between students finding it motivating or not motivating. And this concept of motivation and feedback comes across in multiple parts then of this study as we went on. We used that feedback from that survey to run a trial, and we had 2 different types of letters that we sent out. One was the bullet point letter, which was similar to what had happened in 18J, and one was this more detailed marking grid oriented feedback, which was informed by the survey. We gave extensive guidance to module teams on how they would use these 2 different letters and giving them templates that they could use, and they can insert the feedback in. We gave them guidance on how to brief EMA markers so that the feedback could be put into OSCAR that they could then extract and put into the letters and tweak as needed. And we worked with a data analyst to select students into the 2 different groups. So they were as matched as much as possible so that we had a trial set up working for this so that we could get some level of data about, you know, does the marking grid format or the bullet point version work better for us. Across the 10 modules that we were able to run the trial in, 7 were able to complete it, which was over 200 students. Reasons why modules weren't able to do it, actually K102, which had replaced K101, had a lot of students that needed 3rd marking done, and so they couldn't do it in the time. One module didn't have any students that fell into this category, and another module, the module chair determined that the students needed even more feedback than either the marking grid or the bullet point versions. And we've worked with the data analyst to understand which letter format was more effective in improving resubmission rates and improving the number of students who pass upon completion of resubmission. Now, this slide shows you just some examples of data from that, and where we see actually is, again, we saw variation between modules in terms of which letter performed better, and I'm using air quotes in that sense. And there's no statistical difference in terms of which letter performed better on each individual module, but also when we aggregated it across the entire curriculum area. So in a way, it's a bit frustrating after going through a trial setup that we don't have a nice, clear, definitive answer about which one did better. But we're trying to figure out why that might be. And partly also, we do know these numbers are still quite small. And unfortunately, because K102 had to pull out, that would have been our largest module with number of students. So it's thinking about doing these types of things with modules that have large student numbers to help understand it. So what we then wanted to do to help figure out, okay, if the quant side isn't going to tell us what letter performed better, what are students saying? So we managed to interview students who had received these letters. Only 18 of them wanted to get back to us. 50% of those 18 strongly agreed that the letter provided them with enough information to help them improve their EMA, but actually 22% disagreed with this statement. So there was some maybe dissatisfaction with the feedback given to them. Motivation was much more across the board. And this is really intriguing for us because part of the reason for wanting to send them feedback was to actually help encourage students to take up the opportunity to do a resubmission opportunity, because then that's their chance to keep progressing. And actually, if they're not as motivated after receiving the letter, that is telling us something that what we think is the assumption we have is perhaps not playing out in reality. And in terms of what they thought, if it had enough information, again, that varied. We then did some qualitative interviews with a sample of students from the survey, and to sort of further dig down in terms of their experience of resubmission and what else they do during this period. And actually what was really important to these students was tutor support. All of them actually took up the individual support sessions that the university offers. And they valued the fact that the university offers them the opportunity to resubmit, but there's a lot of emotional work that they have to go through in order to get themselves into the place to be ready to resubmit. And for the students that we interviewed, the tutors played a crucial role in that, much more so than the letter did itself. We also wanted to understand how that wide team who has to create those letters, what their experiences were, because actually it's a lot of work to create this bespoke feedback. Module team chairs actually had a lot of variation in their preference in terms of type of feedback. Most of them said they prefer providing the bullet point feedback because it's more efficient, but they recognize that their module or the EMA type they have might require a different type of feedback. The curriculum managers tended to prefer that there's a standard practice across the curriculum area because they work across multiple modules. So where module team chairs might want to do something different on each module, the curriculum managers who help create these letters wish there was a standard practice. In a lot of the feedback, and also with EMA markers, there was questions around who is best placed to write or provide this feedback. Should it be the EMA marker? Should it be a module team chair? Should it be someone else? And we found that people were having a lot of issues with the OSCAR system in terms of uploading feedback, pulling it down, making sense of what an EMA marker might write in that system. And then people were also telling us it was quite a time-intense activity. From the markers who felt that they had to spend more time writing feedback within OSCAR, and sometimes it was timing them out, to the curriculum managers who might be spending 3+ days on a module trying to send out all these letters. So it takes a lot of time, even though it's only 200 students that are getting these letters. And we also discovered there's lots of areas this process that can still be really improved. So one issue that we weren't able to resolve for the trial was ensuring that the tutors that provide the individual support sessions, which stand the ISS on the screen, with that example of the feedback. So there's still a reliance within the university system that the student provides the tutor that provides them that support session with the EMA and any feedback they have gotten. So there's a bit in our system that we could improve to actually facilitate that tutor support even more. Where we're now is we're currently finishing up our reports and hoping to draw a few articles with bits of that data. And we've fed this back to the program leads now within health and social care to inform the completion process this year, because there was no clear cut saying do this letter or do this letter. And so actually what they have done is ask the modules to decide what they're going to do. So there's no standardized practice at the moment across HSC. But interestingly, quite a few of the modules are still wanting to do feedback letters because they see a value in doing so. And that is it from me.